Imagine a vast, intricate society of cells, each with its unique role, working in harmony to build and maintain the human body. In this microscopic world, cells divide and multiply in a carefully orchestrated dance, ensuring the body's growth, repair, and overall well-being. Cancer, however, disrupts this delicate balance. It's a disease that arises from rogue cells, our own cells, that have forgotten how to play by the rules. These rebellious cells begin to multiply uncontrollably, ignoring the signals that normally regulate their growth. As these rogue cells proliferate, they can form a mass of tissue known as a tumor. This uncontrolled growth, and the potential to spread to other parts of the body, is what makes cancer so formidable. Understanding the nature of cancer, this cellular rebellion, is the first step in comprehending the difference between cancer and tumors. Not all tumors are created equal. Some are well-behaved, like guests who know when it's time to leave a party. Others are more like unruly invaders, disrupting the peace and causing widespread chaos. A tumor, in its simplest definition, is an abnormal growth of cells. It's like a bump or a lump that forms when cells multiply more than they should or don't die when they're supposed to. Think of it as a cellular traffic jam, where cells pile up instead of moving along in an orderly fashion. While the word tumor often evokes fear, it's important to remember that not all tumors are cancerous. Some tumors are benign, meaning they're non-cancerous and unlikely to spread. Others are malignant, meaning they're cancerous and have the potential to invade surrounding tissues and spread to other parts of the body. Understanding this crucial distinction between benign and malignant tumors is key to unraveling the relationship between cancer and tumors. The difference between benign and malignant tumors is akin to the difference between a gentle breeze and a raging hurricane. Both involve air movement, but their impact is vastly different. Benign tumors are like well-mannered guests. They grow slowly and stay put, often enclosed within a capsule that prevents them from spreading. These tumors are usually not life-threatening and can often be removed surgically with minimal complications. Think of a mole on your skin or a uterine fibroid. These are examples of benign tumors. Malignant tumors, on the other hand, are like aggressive invaders. They grow rapidly and have an uncanny ability to invade surrounding tissues, breaking free from their original site and spreading to distant organs. This process of spreading, known as metastasis, is what makes cancer so dangerous. The difference between benign and malignant tumors lies in their behavior and potential to cause harm. Cancer is not a single disease, but rather a collection of over 100 different diseases, each with its unique characteristics, behaviors, and treatments. These different types of cancer are classified based on the type of cell they originate from, and their specific characteristics. Carcinoma. This is the most common type of cancer, arising from epithelial cells, which form the lining of organs and surfaces throughout the body. Examples include lung cancer, breast cancer, and colon cancer. Sarcoma. This type of cancer originates in connective tissues such as bones, muscles, cartilage, and fat. Examples include osteosarcoma, bone cancer, and chondrosarcoma, cartilage cancer. Leukemia. This cancer affects blood-forming cells in the bone marrow, leading to an overproduction of abnormal white blood cells. Lymphoma. This cancer affects the lymphatic system, which is part of the body's immune system. It often arises in lymph nodes, but it can also affect other organs. Understanding the different types of cancer is crucial for accurate diagnosis, treatment, and prognosis. Section 5. Unmasking the enemy, diagnosing cancer and tumors. Diagnosing cancer and tumors is like piecing together a complex puzzle, using a combination of clinical examinations, imaging tests, and laboratory procedures to create a complete picture. The diagnostic journey often begins with a thorough medical history and physical examination, during which the doctor will ask about symptoms, family history of cancer, and lifestyle factors. Imaging tests, such as X-rays, kinetic scans, MRI scans, and PET scans, provide detailed images of the inside of the body, allowing doctors to visualize tumors, assess their size and location, and determine if they have spread. Laboratory tests, such as biopsies and blood tests, are crucial for confirming the diagnosis, identifying the type of cancer or tumor, and determining the stage and grade of the disease. Early diagnosis is key to improving treatment outcomes and increasing the chances of survival. Section 6. The laboratory battlefield, tools of detection. The laboratory plays a crucial role in the fight against cancer and tumors, providing valuable information that guides diagnosis, treatment decisions, and monitoring of the disease. It is here that the battle against cancer begins, with scientists and pathologists working tirelessly to uncover the secrets hidden within cells. Biopsy. This procedure involves removing a small sample of the suspicious tissue or tumor and examining it under a microscope. The precision and accuracy of this method are paramount in ensuring a correct diagnosis. It is the gold standard for diagnosing cancer, as it allows pathologists to analyze the cells and determine if they are cancerous, the type of cancer, and the grade of the tumor. This detailed analysis is crucial for developing an effective treatment plan. Blood tests. These tests can detect certain substances in the blood that may indicate the presence of cancer, such as tumor markers, which are proteins produced by cancer cells. These markers can provide early warning signs and help in the early detection of cancer. Blood tests can also help monitor treatment effectiveness and detect recurrence. Regular monitoring through blood tests can provide critical information about how well the treatment is working and if the cancer has returned. Cytogenetic testing. This type of testing examines the chromosomes of cancer cells, looking for specific changes that can help identify the type of cancer and guide treatment decisions. These chromosomal changes can provide insights into the behavior and progression of the cancer. Molecular testing. This type of testing analyzes the genes and proteins of cancer cells to identify specific mutations that may make the tumor more or less susceptible to certain treatments. Understanding these genetic mutations can lead to more personalized and effective treatment options. Section 7. Tailoring the assault treatment approaches. The treatment of cancer and tumors is not one-size-fits-all, but rather a highly individualized approach that depends on factors such as the type of cancer, the stage of the disease, the patient's overall health, and personal preferences. Each patient's journey is unique, and the treatment plan is tailored to provide the best possible outcome. Surgery. This involves removing the tumor and surrounding tissues surgically. It is a common approach for many types of cancer and can be very effective. It is often the primary treatment for early-stage cancers that are localized. Surgery aims to remove all visible cancer and some surrounding healthy tissue to ensure no cancer cells are left behind. Radiation therapy. This treatment uses high-energy rays to kill cancer cells or stop them from growing. It can be precisely targeted to minimize damage to surrounding healthy tissues. It can be used alone or in combination with other treatments such as surgery or chemotherapy to enhance effectiveness. Chemotherapy. This treatment uses drugs to kill cancer cells or stop them from dividing. These drugs travel through the bloodstream to reach cancer cells throughout the body. It is often used to treat cancer that has spread to other parts of the body. Chemotherapy can be used in conjunction with other treatments to improve outcomes. Targeted therapy. This type of treatment uses drugs that specifically target cancer cells, interfering with their growth and spread. These drugs are designed to attack specific molecules involved in cancer cell growth. Immunotherapy. This treatment helps boost the body's immune system to fight cancer cells. It can be particularly effective for certain types of cancer and is an area of active research. The goal of cancer treatment is to cure the disease or control its growth, prolong life, and improve the patient's quality of life. Each treatment plan is designed with these goals in mind, aiming to provide the best possible outcome for the patient. Section 8. The future of the fight advances in cancer care. The fight against cancer is a constantly evolving battlefield, with researchers and clinicians working tirelessly to develop new and more effective treatments and improve the lives of people affected by this disease. Every day, new discoveries bring us closer to understanding the complexities of cancer and how to combat it more effectively. Precision medicine. This approach tailors treatment to the individual patient, taking into account their unique genetic makeup and the specific characteristics of their tumor. By understanding the genetic mutations that drive cancer, doctors can select therapies that are more likely to be effective for each individual. Immunotherapy advancements. Researchers are developing new immunotherapy drugs and combinations of treatments to enhance the body's immune response to cancer. These therapies aim to empower the immune system to recognize and destroy cancer cells more efficiently. Early detection and screening. Advances in imaging technology and blood tests are leading to earlier detection of cancer when treatment is most effective. Early detection significantly increases the chances of successful treatment and can save lives. Supportive care. there is an increasing emphasis on providing supportive care to cancer patients, addressing not only the physical symptoms of the disease but also the emotional, social, and spiritual needs of patients and their families. This holistic approach ensures that patients receive comprehensive care throughout their journey. The future of cancer care is filled with promise, as researchers continue to unravel the complexities of this disease and develop more effective treatments. With each breakthrough, we move closer to a world where cancer can be managed more effectively, and patients can lead healthier, longer lives. Section 9. A glimmer of hope. Living with cancer. A diagnosis of cancer can be a life-changing event, but it is not necessarily a death sentence. Advances in treatment and supportive care have led to significant improvements in survival rates and quality of life for many types of cancer. Living with cancer is a journey that is unique to each individual, and it's important for patients to have access to information, support, and resources to navigate the challenges of the disease. Support groups, counseling, and palliative care can provide emotional support, pain management, and symptom relief, allowing patients to live as fully as possible. While the fight against cancer is ongoing, there is always hope. Hope for new discoveries, hope for effective treatments, and hope for a future where cancer is no longer a life-threatening disease.
Thanks for watching. Please like, share, and subscribe. And remember to click the notification bell to know when future videos are released.